Good evening, viewers. Welcome back to one of our another episode of Health Talk Show that normally comes on your way every Wednesday on Suicide TV. Today we have a guest from, of course, Parkland General Hospital. He is a senior staff and has been serving in the health system for so long now. I'll allow him to introduce himself before we proceed to the topic of discussion that we're going to discuss today, inshallah. Sir, you're welcome.
Thank you very much, Muhammed Sanneh, and good evening once again for giving me the opportunity to come on this very important platform, which is the Suicide TV. I am Sainey A.M Drammeh, like you rightly mentioned, a registered nurse. I've been working at Parkland General Hospital since year 2018 up to date. Most of the time I was at the OPD where I actually see patients.
Thank you. As you all heard him, Mr. Drammeh, you are welcome today. So today our topic of discussion that we're going to send on is going to be on gastritis. The format that we're going to do is going to be the definition, the causes, of course, the signs and symptoms, the management, prevention, and of course we're going to talk more on health or anything that have to deal with this topic, of course. So, Mr. Drammeh, first, can we start on the definition? What can you just tell us about the definition of gastritis?
Yeah, gastritis is is a disease that belongs to a major disease called peptic ulcer disease.
Okay.
And it's actually an inflammation of the gastric of the stomach and the gastric lining.
So, what are the causes? I think that causes, because people saying so many things about gastritis. Yeah. So, we want to know what causes gastritis.
Yes, like you said, the causes of gastritis are varied, and a lot of factors do cause it.
Okay.
One of the factors that actually causes gastritis, it has to do with our lifestyle.
Oh.
Yeah, it's more to do with the food that we take in.
Okay.
Okay, and secondly as well, it was later on found out that there is one causative organism called Helicobacter pylori.
Okay.
This Helicobacter pylori actually lives in the gut.
Okay.
According to experts, half of the world population have Helicobacter pylori in their gut.
Wow.
Yes, and that makes it one of the biggest diseases now in the world.
Oh.
Yes, in the Gambia here, if statistics are going to go by, especially if Farafenni General Hospital is going to be a microcosm of the whole Gambia, I always tell patients that next to hypertension and diabetes is gastritis. Yes, hardly a day goes by we don't have a lot of patients coming with complaints of gastritis. Yes, so Helicobacter pylori is one, because what the Helicobacter pylori actually does is that it actually kind of like the mucosal lining of the stomach.
Okay.
The Helicobacter pylori actually tries to erode it.
Okay.
Okay, because like all human beings, all of us, we have hydrochloric acid in our gut, and this hydrochloric acid is very, very important.
Of course,
okay,
yes.
But once the stomach has this causative organism, which is the Helicobacter pylori, then it actually weakens that mucosal lining, which is actually a protective layer, against this hydrochloric acid. And once that protective layer is actually destroyed, then you will see that the stomach is no more able to actually be, get itself, protected from this hydrochloric acid.
Oh.
Yes.
Yes, now the causes, of course.
Yes.
One, as he said, our lifestyle and the food that we consume, of course. But again, as he said, the most common again is the the virus that, of course, the bacteria that he mentioned. So, what are the signs and symptoms? What are the signs and symptoms of this gastritis that you're talking about?
Chiefly, the signs and symptoms commonly is heartburn. Heartburn is a very, very common signs and symptom of gastritis. Okay. That is this indigestion, that when you eat the food, your heart actually burns. Okay. But just like we know, actually it doesn't mean the heart actually burns. Okay. But where the pain occurs, of course. Actually is very anatomically is very, very close to the heart. Of course, so that is why the name. So since in the olden days, from the European world down to our own local language, is still the heartburn. Yeah, so heartburn is one of them. Secondly, you have an epigastric pain. Okay. That is just around here, somewhere in the middle of the stomach, in the middle of the chest. Okay. You have a pain there that actually radiates to the back. Okay. Okay. Retrosternally, it radiates to the back. Right, okay. So that is another sign of it. Another sign can be bloating. You feel like your tummy is full of air. Yeah, okay. That is another sign of it. Another sign also, something that they call balloting. It's like something is moving inside it. Yes. Normally when ladies come, they say that it's like a live thing. Like if a lady is actually pregnant, the way you feel the baby moving.
inside.
That's the same thing you feel also. That's called balloting as well. That's another sign also.
That's another sign.
Yes.
So basically, these are the signs of gastritis, of course.
Right.
Okay. All right. So the management. Well, I know, like as you said, almost our lifestyle almost causes it's a contributing factor that causes at all this gastritis.
Yeah.
I know, of course, the management will be very, very difficult, of course.
Yes.
Yes.
That is very true.
So what is, of course, the management of this gastritis?
Yes, management of gastritis actually it's like if anyone actually starts exhibiting these signs and symptoms, your best will be to go to the nearest health facility where you are, and the doctors will actually ask you, take a history, and then will also try to see if the clinical picture, what you are seeing, actually fits the clinical picture of gastritis. If that's the case, then they definitely are going to start their treatment. Okay, the treatment will start, and where definitely the person starts improving, then you definitely know you got the diagnosis right. But further management also can be done at hospital level. You can actually do an abdominal ultrasonography or ultrasound that will actually be able to actually confirm the diagnosis. Yes.
So doing the abdominal scanning will help you to determine or to know exactly whether it's gastric or not
exactly.
Okay. So do you have like specific medications or that people are like that you think at least somebody having gastritis should take that medication? And that medication, is it like it's a lifetime medication, or summertime that whenever it attacks you at a time you have to take it, or if you take it also with help of the diet that you use will help you to reduce the medication that you're consuming?
Yes, gastritis per se, you cannot just get rid of it in one day. That is very, very important. Okay, the medications we normally take, we call them PPIs. That's what they call protein pump inhibitors. An example is omeprazole. Omeprazole is yes. You also have lansoprazole, but within the Gambian setup, the most commonly used drug is the omeprazole. Okay. We also have an antacid, because like I told you, hydrochloric acid is plays a big part there. So we definitely have to keep that acid level low. So we definitely give a drug that will actually counteract the effect of the acid, which is called an acid. An example is magnesium triesilicate, which is normally given the brand name Magtri. So Magtri is very, very important in this case as well. Okay. So we also have other drugs that you can also use, like the HS2 blockers, like cimetidine, and another one is called ranitidine as well. So ranitidine or cimetidine, you can use these drugs also in the case of gastritis also. So these are basically the type of drugs that are normally used.
Okay, so I would say like the one to that have to do with let's say the pharmacological treatment or the medical treatment aspect. So it's like, do you have any like advice when it comes to the diet or the lifestyle of the individual to be able to or reduce or to call it help in the treatment of this gastritis?
Yes. When it comes to gastritis, yes, very, very hot foods. Because what happens is not everybody is actually allergic to pepper. But if you are somebody who is allergic to pepper, then you should definitely stop using it. Because what the pepper does is that it's actually an acid as well. Like I said, the problem is with the acid. So anything that is going to actually increase that acid, we have to do away with it. If you go back to our primary school, if you come to the acids, we have different type of acids. You have what they call citric acid, you have what they call lactic acid, and you also have ethanoic acid and all these acids. So already the human body have its own natural hydrochloric acid which is inside. So now that the hydrochloric acid actually is doing a problem, you want to keep that level down. Anything that's going to increase the level. So therefore, if you very, very spicy foods, very, very sour foods that are very sour, and that ones that are also very bitter. This is very, very important, Mr. Sanneh, to make sure that you actually limit those ones, or at extreme cases do away with them completely.
I know this kind of food will be very, very challenging to the other gender, that is especially the female side, the women. They always want to consume such food. This sour food and pepper, irrespective of even them having that. Yeah. So as you know, that's almost the management and the prevention. How can we prevent having such this kind of so it's preventable?
Yes, like you say, Mr. Sanneh, thank you very much. It's a preventable disease. And that means that we should be able to actually do away with that gastritis. So the first thing is lifestyle modification, which is very important. Well, that means when it comes to our diet, then our diet shouldn't be too spicy. We should try to keep spice at the minimal. That's very, very important. And also those who are having gastritis also, or those who are prone to gastritis, should actually limit, taking a lot of sour foods. That's very, very important. Smoking obviously comes there also, because people tend to forget about smoking. Because what this smoke actually does is it also actually erodes that gastric mucosal lining, which is a protective layer against this hydrochloric acid. So those are very important things.
Alright, so until we're gonna say lifestyle also matters. That is the food that we consume. Of course, you have to know, and of course, the smoking also. This we need to also. So if you are to generalize, like just to help educate or to tell people about the anything that's important that you think we need to know about gastritis, what will it be?
We need to know that gastritis is preventable. That's very, very important. And we need to know that our food intake actually, actually poses a great deal towards actually having gastritis. So we should definitely have a very good check and balance against the kind of food that we eat, that we don't actually try to consume too much, sour. And also it's very, very important that also we try to keep be very hygienic, because having talked about Helicobacter pylori, Helicobacter pylori actually thrives in a very, very moist, overcrowded, damp, and less hygienic conditions. So that actually gives us a very, very good breeding ground. That means hygiene and sanitation plays a very, very big part when it comes to actually prevention of gastritis.
Cleanliness is, of course, cleanliness to godliness. Okay, so since we have said almost a summary of this in English, so we want to go at least our local language to people that are almost watching us as well. Welcome. You get connected to the center, and you come talk so more what I'm doing. I'm seeing every Aralba. I'm not seeing Boku I'm being put by a preventive hospital today. To Sainey A.M Drammeh. Ko ba mon tamat lis mo wax at least discover not ko mo gastritis mbadi la mo la bi na dun tango soro jam mo boda preventive hospital to mo Sainey A.M Drammeh bi nga to do soto mo at least sa xam yalan ko ma mo botani kan so bi mba bula pa fana de mo dim fo ye na kam nga mo fo english kan ba fa la mo ko inshallah Drammeh
yo ala baraka bake mbari jimbe laro men kal be suñu site tv jibe kan alhamdulillah mbal kontona mbal ni mbara bake alla la moy kunyima nan la jibe ni makam bimbe men foka wala gastritis man ka kan wala jusukun dokaliya mojo maka fayna jusukun dokaliya fene de men ko biya siata bake na banko kam bake aka dinnulu muta ka kebal muta aka musul muta ka kewol muta ndol membe do ko lopan bundato ngamol je wato wati akumata bakele nimon pour nga fumole munam juskun tokaliyati jama juskun tokaliya aka commencer nyaadi le wala ikaro nyaadi loka be wala jama jiso ke janire annum fana ika dimo so me yalan ko aka stade juskun mota jaka findi koma dol sa fo ko akamta ko niyar num mole muta en son koma so aka ke wala nyama annum fana tumando fana taman siro fana kono ikono nyin ka fa fonyola nyin ka fa ikono nyin kono anno abeje fana akamto ko fenne kam mom me kono do jama fa safu ko akamto ko niaron fenkendo kam mom kono nyilbe mana taman sero lati annu fana taman sero do fana beje wala watu wati ikadu kirintila warande ka sokojo ke mari muta watu wati o fana mbala fe go ka dum ne kada gaso me farin kono wala ka fintenan wala ka ne mari ka sokojo ni soro so nyilbe mana taman sero te me yalan ko nimme o suite fa mbala dron yani imari nyanta menkele wala yakata ba ke ta loptano to pour nyin kamala ko isi de maro soro
so Mr. Sam comme ya fo nyame den sa ni moye nyi fen ko yin sa so de ko mu fo ba ko bisu ko career anaya so do amne kala ka fan tanka ka lon ko at least wala na ma so do na mun kala ka fan tanka ka so ko ni fen ko ata so do
okay comme ya fo nyame Muhammed baraka bake gastritis mu fenne de me yalon ko sim fan tanka no wala le so fenne me yalon ko jama mul fon la ila manya Kenya le mo anin ila ko la Kenya wala ka tan jama'a ma mulkan jiskun to kaliya so sai en folo akuma ta ba kele mo si le domor ken ila domor fon mu da yaken so ya jibe karu domor fon jama'a ma atabe den ni wala bala abe bala ka nyin kane fon ka no nyanta katala ka no ma fa ko man beta yade bari momo yalan ko ni ka no do dolbe je ni ka no ba ka fenke bari momo yalan ko ya su de famala ko ni ka no mu da yado mo aka fenke la ka du kanu ay nafa fon so bari ni aje ko ni ka no mu da ngata dron akan batan le don wodete nyaame ma nyanta kel mo me ko kanu ni te farno la bari ya tala ba aboko no kumi fon fanan ka du ngafo nyaame ni ko acido nyin do mo fon be acido so kanu ya acido so le kumi fon li acido so hani nyin no kumul fon be acido so le vinaigre acido so le ani nyin drink sol me yalan ko e gaso so olbe yalan ko fenne me ko e gaso so sa harabaru mo kono fon kono Muhammed gas acido le be je me yalon ko ala fongolo muta da harabo kono kono sai wo acido nyin na be harabo kono kono ala ya da nyamen wala kono nyi bantam bilol so me yalon ko aka tankarangoti bar sai no tankarang nyin tinyata kono nyin kono dron sai wo acido nyin kayo sai kana ke montoro di mari so wala ni mari nyin do mo fongol muta yol tala dron o se keno silo de me yalon ko sim fa da de me yalon ko be mari tankandila pour ka nyin jusku ndakali ya nyi so
okay barka ba Mr Drammeh sai comme niñe nimmole ñi fenko so nata lo tan ko ngal ko bor bi jëm yalon gal alka wodi ala atele so ngal ko ko boro fofo na ata ko man ga way bada at least isamo ngamal ka ko boro ñenda ka tamé mata ni mo ya sayo fana comme ñenda ka tale because ni mata fana asa fen ko mi ko masa dora kel ñaar do mandi so boro la ta at least mo diamundi wo fengo nga jiwe abatan
abara ko ba Muhammed ya fo nyamen boro le be je miano ko isita no ne Gastritis soro abo boro ko no boro be je miano ko kafa omeprazole nyinga telephone do ko men wala nyindi ko kono blala be je miano ko wala ka tan acido nyinga fendi harba dum bolo kono so ataka men ga kata blala pour ka fo o fo nyi meme balo kono nyimbala pour ka tan dala ko acido nying e kamen fenga ala hapo nyi yatala ikafa ko omeprazole wala na te jamani ma yenta min na jandi be do ro nyinga biko hala ni do mo ko don ka do nyina jela manji fo ni do mo ko don ni kono fara don o kadna acido kala fa kongo fanan kala fa la fanan wala na mo nyaa ka nyamena ko yek jiskon to kala yasoro bayde ko ni kon ko don di mo nyin kanale ba ni do mo fanan kono fanan fara ko kono tam don di mo nyin kala ko tenke sa o boro nyin ko bo do fanan be men fanan ka fa mak try o kamen ko wala nyindi ko acido nya kala ni ado sa acido nyi finta foka pare boro nyanda sort la me alon ko nyanta pour ka tala o sa o boro nyin ka fole ko mak try adi jawani mai ka fone yanyi mi ka te nyimide ate ni ado yedo mo ko foka pare bara ate jawani ma ni juskunde jawno nyata wato men o tamo e ka te nyimi kado sa ngi ko mo acido nyin sara foka pare ni amude yanyi don aka menge wala acido nyin na sembo nya ko mo ta ka tala ni kuma ka yo yindi munun kele pour nyin kamala ko dimo nyin e se fata dimo nyin
okay baraka ba ke Mr Drammeh kontanda ba ke bi so at least ko ngal wato man siya ba ke na ke tay lafta fenna fola mol both in either in English or Manikabonga is at least adiam for more vital inshallah. Yeah.
So alhamdulillah I have nyamen drong ntol be kilin nan sim fantan kono Gastritis mare ba ko nga fo nyamen ten kuran na me alon ko sim fantan kono wala so men kum mata comme ça quand même fo drong tankaro wala jawya wala betera jarlo ye fantanka ando ni me fenne ba me ko me si fantan kono wala nyanta men kilen ntol be kilin na si sim fa dalta men sa nan sim fantan kono ni Gastritis la abo ko nan no do mo fon mo ngi ken sung abo fanan kono fanan ngatra ngoduna dal seneyandi do senaya fanan kumata jebakele bawo kuran keso do be memo helicobacter pylori anu katara dula dan dinka me anko e dinka me anko e man janku bake man senaya bake dinka me anko be monitoring aka atakala fo dinka sifala to ni ngadula jankon drong so bayla kuran keso ni kum ate silo sorno men satna asinaki ni montura fon.
Yeah.
Thank you very much, viewers. Summarizing leaders about gastritis. Gastritis, like we all know, is a preventable disease. We can all prevent ourselves by following lifestyle modification. Let's try to check our diet. Make sure that we eat less spicy, less sour food, and we make sure that we also try to quit smoking if we smoke. That is very, very important. Try to keep our environment very clean. Our hands, especially hand cleanliness, is very, very important because they will say that most of the 90% of the microbes that we have actually live on our hands. So hand cleaning and sanitation and keeping a very good hygiene and looking at all these factors that contributes to gastritis and try to lessen them will actually save us from having this gastritis. And anybody who also have the signs and symptoms, your best bet is to go to the nearest health facility as quick as possible so that you can get help. So thank you. On that note, thank you very much.
Thank you, Mr. Drammeh. We are very, very happy to have you on our day's platform. Of course, it was a very educative platform, and then we have learned so many things today. And I guess those who are watching, and of course, those who are of course listening, I hope you all adhere to what Mr. Drammeh just said. I know the time is not that much; almost the time have already elapsed. We will tell you thank you, and they will see you next Wednesday, inshallah. Thank you.